So let's talk about this case. If you guys don't know who I am, my name's Jeff. I'm the owner of Paramedics, and I do a lot of the education here with Ben and Chris. And so we do a lot of these case breakdowns. What we do at Paramedics is that we focus on EMS education as a whole. And a big part of what we do is work with students. So if you're struggling in school, you're trying to get better at your grades, or you're having trouble studying and understand medicine, that's what we do. We cut study time in half. We give you your life back. We get you feeling confident about walking onto an ambulance. That's what we do. So hopefully you guys are interested in that. You can definitely check us out for free at the link in our bio as well. Sign up for a free trial. Check it out. If it's something that you love, you can stay as long as you like. If it's not for you, you can cancel anytime. Okay, so that's my little plug. Let's get into this case. So pediatric patients as a whole can be very challenging, right? They can be really difficult. They can be really confusing, especially when you don't have a lot of familiarity with children. So what I'm gonna focus today on is really focusing on the aspect of how to assess them properly, looking at vital signs, and then we'll talk about this case in general as far as what we can do for them in this particular patient. So let's take a look at this patient. So you are called to a 6-year-old female patient who is complaining of severe headaches and increased fatigue. You arrive to find the child in her bed with the lights off. When you turn the lights on, she is clearly in distress. She's pale, tired, and in a lot of pain. She has a fever of 38.9 degrees and is not drinking many fluids or eating. It should change a little bit in a sec here. Okay, so this is the presentation of your patient. She is got quite a bit of dark circles underneath her eyes, so probably not sleeping very well, very fatigued, complaining of a lot of pain, especially on palpation, as you can see here. Not happy, laying in bed, not sleeping very well. Okay, so that's what we have so far. Now let's take a look at these vital signs to get an idea. Okay, and based off what we have here, she's complaining of neck pain, she's fatigued, she's not sleeping well, she has a temperature. Based on those symptoms and that photosensitivity talking about really didn't like it when we turned the light on to talk to her, what are some things that come to mind as far as differential diagnosis? So what is your initial diagnosis for the patient based off basically the first couple minutes of interaction with them? Go ahead, put that in the comments. Here's the thing about initial presentations and differential diagnosis. The idea with differential diagnosis is that you need to be thinking other things as well. Okay, so meningitis is at the top of our list. And let's say we want to avoid convincing ourselves that the only thing it could possibly be is meningitis. So what are some other things that still fit the description of the presentation? Is there anything else that we should be thinking and ruling in and ruling out? Because man, a differential diagnosis is not designed to be the only diagnosis. We're designed to be thinking about what other things could be, so that way we don't miss anything. Very much like when someone says they have chest pain, the very first thing you don't want to be thinking about is they have a heart attack. That's the only thing it could possibly be because they have chest pain. Well, there's 6 other different deadly chest pains that could be out there. So let's do the same thing for this. What are some other differential diagnoses that fit the description here? Go ahead, put those in the comments. There's a lot that we can unpack here. So let's go ahead and do that. So that's why I'm thinking when it comes to diagnoses is that what I'm thinking is that first off, with the presentation, I'm thinking meningitis as well. But regardless of what disease process it is, does it really change your treatment path? Probably not. Whether it's meningitis or flu or anything else that can also cause sepsis, you're probably not changing your treatment path too much. But it is always good to be thinking about what could possibly be going on. You could even just say your differential diagnosis is this patient looks like they are septic or severely dehydrated, hypovolemic. Those are the kind of things that you can look at as well, as opposed to just pinpointing it to one disease process. But it's good to think about these things and what are some of the things that we can be thinking about. Okay, so let's move on and take a look at the presentation. So like I said, I wanted to talk more about how to assess this child and identify how sick they are. So regardless if we think this is meningitis or a trauma or dehydration or any type of flu-like, those kind of things, regardless of what it is, we want to know, okay, how are they doing? Okay, how are they doing? And the best way to determine how they are doing is by using the pediatric assessment triangle. Okay, so the pediatric assessment triangle is combined of appearance, the work of breathing, and the circulation. And these things combined can give you a pretty good idea of how that patient is doing, as opposed to things that we use for adults. Okay, so when it comes to these three things, let's look at them individually. So when it comes to appearance, things that we're looking for is abnormal tone, less interactive, less consolable, abnormal cry, abnormal look or gaze. Okay, so just simply fatigued, not interacting, not consolable. Those are the kind of things you're looking for that to indicate that they have an appearance issue. Next thing is work of breathing. And work of breathing is thinking about things like abnormal sounds, abnormal position, retractions, flaring, gasping, things that you would suggest that would come up if a patient was having struggle getting air in and out, ventilating, which is a very common thing when it comes to pediatrics. This is typically what you're going to be seeing with pediatrics. Unfortunately, not in this case, but that's something that you would be often seeing abnormal problems with is work of breathing. Finally, circulation, things like pallor. Okay, paleness, mottling, and cyanosis, particularly in the lips, are all things that can indicate that we have a circulation problem. Okay, and these three things, circulation, work of breathing, and appearance combined, give us a pretty good idea of not what is going on with the patient, but how are they doing based on the disease process. Okay, so when we are considering these things, taking a look at this presentation, what sides of the triangle would you figure that they are worried or they're struggling with the most? Okay, what sides of the triangle do you think that they're struggling with the most? Okay, I'll go back to the patient presentation here. Oh, there it is. Okay, what do you think they're struggling with the most? Is it appearance and circulation, work of breathing? What are you thinking? So she does have, like, you can see some good circling, like dark circles under her eyes. Her lips are a little bit blue as well. She's pale, so I'd agree. I think she does have some sort of a presentation of circulation issues that we need to be taking consideration. I think that her appearance, her fatigue, her pain, her inconsolable, those types of things are telling us that we have an appearance issue. So those are the two sides of the triangle that we're really probably looking at here, is more of an appearance and circulation issue. Okay, and so when we're looking at two different parts of this triangle, there's actually some things that we can pinpoint when it comes to those. And it's not a perfect science, but it allows you, especially someone that doesn't deal with pediatrics very often, again, this is how this class is tailored, is more to people that are not dealing with pediatrics on a regular basis, to make it nice and simple, is that when you're dealing with an appearance issue with circulation signs, you're often dealing with some sort of shock. Okay, a perfusion problem. And that's probably what we're looking at with this particular patient. And then if you have issues that you're seeing more of work of breathing and circulation issues, and you're probably looking more of a respiratory distress, as severe respiratory distress is probably what you're looking at when you see more signs of work of breathing and circulation, showing more like hypoxia. And then if you have combinations of all three, you're probably looking at something like respiratory failure and then leading to cardiopulmonary failure. Okay, so these are the kind of things you can use this assessment triangle for. So when you find signs, these are the things you can start thinking about in order to direct how you're going to treat this patient. Okay, so using the assessment triangle to your advantage in order to pinpoint things that you need to be paying attention to. Okay. So based on that presentation and based on what we've talked about so far, and we've talked about how we think that this patient is dealing with more appearance issues and circulation issues, we're probably looking at this patient being more in a shock state as opposed to a respiratory problem state. So let's focus on that. Okay, so let's look at these vitals and kind of give us an idea, because we need to see how well they're doing. We have an idea of their appearance, we have the idea of their circulation, so we know that they're sick. Okay, we need to investigate a little bit further, so let's look at their vital signs. So their heart rate was 129 their blood pressure, 78 on 49. Their EtCO2 was 36, breathing rate was 28, SpO2 is 94%, and the temperature is 39.1, which is about 102 degrees Fahrenheit. So they do have a fever, and a pretty significant one, moderate to severe. Okay, so I know that we don't deal with a lot of vital signs when it comes to pediatrics. Now, one thing that I will mention is I don't really recommend trying to memorize pediatric vital signs. I think that's kind of a useless thing. What I want you to be kind of thinking about is more having some sort of note, having some sort of card, book that has a range that you're going to be focusing on. So that's why I have none of them written down here as far as what we should be seeing, because I think that it's more appropriate for you to be looking up what to expect for that age group as opposed to trying to memorize it and for me to try and, teach you different ranges of numbers you're not going to remember. So let's talk about each individual vital sign separately so that way you can kind of pieces the puzzle together, okay? So when it comes to the heart rate normal range is going to be dependent on their age. Okay, it's typically going to start getting slower and slower to more adult base till when they're about 12. Okay, so the older they get, the lower their normal heart rate is. Okay, so when they're tachycardic, they likely are going to be in some sort of shock, whether they're compensating for it or not, or hypoxic. Okay, when they're bradycardic, we need to be thinking that they're in some sort of hypoxic state or severe hypoxic state. So those patients that are in peri-arrest that are bradycardic, it's usually due to hypoxia. Okay, next, look at the normal blood pressure based on their age. Okay, so equations for you guys to know, a normal blood pressure for that particular age is 90 plus 2 times their age. The baseline for hypotension is 70 plus 2 times their age. So this patient is 6 years old, 6 times 2 is 12. 90 plus 12 is 102. That's our normal blood pressure. Our hypotensive line and below is 70 plus 12. So 82 systolic, okay? And we are below that. So in this particular case, this patient is below the hard line of hypotensive for their age. Okay, which brings me to my next question is this patient in a compensated or decompensated shock? Go ahead and put that in the comments. Compensated or decompensated state of shock? Well, so you're saying are decompensated? I would agree with you, okay? So do they have compensation kicking in? Yes. That's how tachycardia is, okay? When you have tachycardia, compensation is kicked in. The next question is, are they able to maintain perfusion? And the best way to determine if they're able to maintain perfusion is looking at their blood pressure. Are they hypotensive? Yes. That means that they're not able to maintain perfusion, suggesting that they are in a decompensated state of some sort of shock. So they are decompensated in this particular state. Okay, so that's what we know based on their age plus 70. Okay, so 70 plus 2 times their age means that their systolic pressure should be 82 and above. But in this particular case, it's 78, suggesting that they are hypotensive, meaning that their compensation factors are not maintaining them. Okay, and the two big other things that we need to be looking for, SpO2. Looking for SpO2s, they're pretty much the same as adults. Just keep in mind is that they don't compensate very well. So they don't have reserves like adults do. And so we can maintain hypoxia for longer than a child. So you need to understand is that when you see even mild hypoxia, don't expect them to stay mild hypoxic for any given amount of time. Okay, this needs to be treated quickly and aggressively because again, like I said, they do not have compensation. They do not have the ability to maintain that for very long because they are in such a high demand, even without sickness, to maintain oxygen levels. And so when you see mild hypoxia, don't just think, okay, we have time, because you don't. Okay, they will decompensate quickly when they show signs of hypoxia. Okay, so that's kind of what you're looking for in adults. The SpO2 limits are the same. However, just know that a child will decline faster than an adult will. Okay, Last thing is respiratory rate. Now, based on respiratory rate, again, the rate is based on age. The younger they are, the faster they breathe, and the older they get, the more closer they get to an adult range. Again, don't memorize it. Have some sort of cheat sheet in order to do that. Next thing is maybe the earliest indication that something is wrong. The respiratory rate is really an underutilized device and useful tool for you to identify. And so just throwing 18 on there isn't really, a big use to you. And so if you're actually counting and actually identifying that they have tachypnea, that could be a really good indication that something interesting or something is going on inside that body that they're trying to compensate for, because the respiratory rate is a very good indicator of some sort of shock going on, especially if they don't have any respiratory compromise, where they're not having any type of difficulty breathing, but they still have a respiratory rate that's increased. That's an indication that they have some sort of shock that they're compensating for. The respiratory rate goes up when they're trying to compensate. So that's something to look for, and it's often one of the first signs of shock in a patient. Okay, so after everything that we know at this particular point, what type of shock is this patient in? We know they're in decompensated state of shock. We know that we're thinking differentials, meningitis, maybe something that's kind of our main differential, but we have a couple other differentials that are kind of head-wise, dehydration, those types of things. But based on what the information that we have right now, what type of shock do you think this patient is in? Okay, so hypovolemic shock, septic shock, hypovolemic. So you're kind of bouncing towards both of those. I think that you're, luckily both of them are going to be treated very similar in the sense that hypovolemic shock, is she probably dehydrated? Even if she does have septic shock, yes. Okay. Would I classify this as more of a septic shock more than hypovolemic? Yeah, I would in that particular case. But again, they have low volume in septic shock as well. So would this be classified as septic shock? Most likely, but they also have hypovolemia because of the third spacing that happens with sepsis. So that's what type of shock we're in. We have a decompensated, septic, most likely state of shock. This patient has issues with their circulation and issues with their appearance. And so we have a patient that, yeah, follows kind of along the lines of this patient is in a decompensated state of shock that's septic. Okay, and we're going to talk more in depth about sepsis in patients. I wanted to really focus more about the pediatric assessment triangle, the vital signs with this particular class. But I will give you a little bit of tidbit on this, is that what are we going to do for these particular patients? Okay, because there's not really much we can do. Okay, great, they have meningitis. Is there any specific treatment that we treat as paramedics or as EMTs with meningitis? Not really. We treat more the sepsis side of things. And just like in adults, we would be treating with fluids, okay? And we would be treating with reducing that fever and treating with Tylenol or something along those lines in order to reduce, or antipyretics to reduce that fever. Okay, those are the two big things that we're going to be doing for pediatrics in a septic state of shock. Is one, treat them with fluids, okay? Early recognition of sepsis and treat it with fluids just like we would adults. And the second thing is try and control that fever by providing some sort of antipyretic like Tylenol. Okay. Any questions with this case or class or pediatrics in general? I'll admit I'm not a pediatric professional. I don't work with pediatrics, I work with adults, which I think is relatable to you all, is that I'm trying to keep this as simple as I can for you. And I'm planning on bringing on more experienced pediatric providers in order to give you some more pediatric advice and more pediatric treatment. But like I said, I wanted this to be simple, straightforward for you all, so you can kind of take some pieces like the pediatric assessment triangle, the vital signs, and understanding that yes, they are different than adults, and these are the tools that we can use in order to identify problems and treat them, because a lot of the time it's very difficult. So go ahead, put your answers in the comments and I'll do my best to answer them. We do have the patient scenario book that is available for you all. So if you guys struggle with scenarios, this has everything you need in order to prep and do scenarios themselves. This guy is going to get you through. There's EMT, paramedic level education in here, so that way all the treatments are broken down in 2 different levels. This is available. The ebook is also available with the expansions of the MCIs, the airways, the pediatrics. All is available as far as the expansions as well, so that way you can get a bunch of different scenarios. And so that's all available at the link in our bio if you want to check that out.